Do you ever notice that a child has very light-colored skin and hair, almost silvery, and later suddenly starts getting very sick with fever and confusion? That could be more than just a skin issue. Griscelli Syndrome Type 2 (GS2) is a rare disease where the body's immune system and pigment system break down. Imagine your hair has a natural color because of tiny packets of color, melanin, moving into hair cells. In GS2, these color packets can't move properly, so hair looks unusually pale or silvery. But it's not just about looks. The same problem affects immune cells, making the body attack its own organs. Scary, right? This disease mostly shows up in babies or young kids and gets serious fast if not treated. Think of your cells like tiny factories with workers and delivery trucks. In GS2, one important delivery truck, a protein called Rab27A, is broken. This truck is supposed to move pigment into hair and skin cells and also helps immune cells know when to stop fighting. When the Rab27A gene is mutated, changed, the truck doesn't work. No delivery equals silvery hair. And worse, immune cells go crazy like workers without a manager, attacking the body. This gene problem is inherited. So if both parents carry a broken copy of the gene, there's a 25% chance their child gets the disease. It's like both parents passing a typo in a user manual, and the machine can't read it anymore. First, the child may have unusually light, silvery gray hair and light skin, even if the family has darker tones. That's often the first clue. But later, usually before age 5, the child may get very sick, high fever that won't go away, seizures, confusion, or even coma. This is called hemophagocytic lymphohistiocytosis, HLH, where immune cells flood the organs and eat blood cells. Imagine the body's defense team turning into a mob, destroying its own city. Other signs: enlarged liver or spleen, belly feels swollen, low energy, and frequent infections. Early symptoms might look like flu, but they don't go away. The combo of silvery hair plus severe illness equals red flag for GS2. First, they look at hair under a microscope. In GS2, the pigment is clumped oddly like paint splattered in one corner, instead of spread evenly. Then they run blood tests to check for HLH, high iron, low blood cells, signs of immune overactivity. Genetic testing confirms it by finding the Rab27, a mutation. Imagine DNA as a recipe book. They are checking page 15 for a spelling error. Treatment: no simple fix. Steroids and chemo-like drugs calm the immune storm at first. But the only real cure is a bone marrow transplant, replacing the broken blood cell factory with a healthy donor's. It is like swapping a faulty engine in a car. Without transplant, most children don't survive long. Early diagnosis, better chance. Can we prevent Griscelli Syndrome Type 2? Since it's genetic, you can't prevent it like a cold. But families with a history can get genetic counseling. Think of it like a family health map. If both parents are carriers, they can test embryos before birth or use IVF with screening to avoid passing the broken gene. It's not about stopping life, it's about making informed choices. For future siblings of a diagnosed child, early genetic testing can catch it before symptoms start. No lifestyle change prevents GS2, but awareness and planning can save lives. Scientists are studying gene therapy, fixing the broken Rab27A gene directly. Imagine editing the typo in the DNA manual so the delivery truck works again. Early trials in animals show promise. Others are improving bone marrow transplants, making them safer with fewer side effects. There's also work on targeted drugs to calm the immune system without harsh chemo. A 2023 study used a drug called imapalumab for HLH symptoms, helping stabilize kids before transplant. While rare, GS2 is teaching doctors a lot about immunity and cell transport, knowledge that helps other diseases too. Hope is growing, one lab test at a time.